Hey everyone! Welcome back to VetCare, where we turn veterinary science into simple, useful knowledge. Today we're breaking down must-know veterinary terms, so whether you're studying or just love animals, you'll understand exactly what vets are talking about. Let's dive right in. Let's begin with the difference between veterinary science and animal science. Veterinary science is all about animal health, preventing, diagnosing, and treating disease. It's what vets study to care for animals. Animal science is broader, it focuses on how animals grow, behave, and are managed, especially in farming and research. Veterinary medicine is both a science and an art, the science of understanding disease, and the art of healing. It includes not only treatment but also preventing diseases that could spread from animals to humans. It's divided into two branches. Clinical veterinary medicine, which focuses on diagnosing and treating sick animals, and preventive veterinary medicine, which keeps animals healthy by stopping disease before it starts, through things like vaccines and biosecurity. Now let's define health and disease. Health is when an animal is living in balance with its environment, showing normal behavior, movement, and appetite. Disease is when something disrupts that balance. For example, fever and swelling are signs that something is wrong in the body. That brings us to signs and symptoms. Signs are what a vet can observe, like fever, swelling, or coughing. Symptoms are what the animal feels, like abdominal pain, nausea, or tiredness, things we assume based on their behavior. Signs are measurable, symptoms are not. Let's look at different types of symptoms. Premonitory symptoms appear early in the disease, like shivering before a fever. Idiopathic symptoms point to a specific disease. For example, wounds in the mouth, legs, and udders suggest foot and mouth disease. Indirect, sympathetic, symptoms come from another organ, like vomiting in dogs due to kidney issues, uremia. Typical symptoms are common in a disease, like crackling and swelling in black quarter, but may appear in other diseases too. Atypical symptoms are unusual signs that don't normally match the disease, like when a chicken with coccidiosis shows nervous behavior, which isn't common for that illness. Periodical symptoms come and go, like fluctuating fever in trypanosomiasis. Pathognomonic symptoms clearly identify one disease, like lockjaw in tetanus. Prognostic symptoms help vets guess how serious the illness is and whether the animal will recover. For example, if a sick dog has very high fever and stops eating, it might be a sign that the chances of recovery are low. Prognosis means predicting whether the animal will recover. For example, in calf pneumonia, if symptoms are severe, the prognosis is poor, meaning survival chances are low. Some other important terms. A lesion is any visible or microscopic damage to organs or tissues, for example, ulcers in the intestine seen during postmortem. A complication is an added problem that occurs during illness, like lung congestion from prolonged bed rest. Sequelae are long-term effects after the disease, for instance, paralysis after polio, or tooth discoloration after tetracycline treatment. Convalescence is the recovery period, the time it takes for the animal to return to full health. Now let's talk diagnosis, or how we figure out what's wrong. A tentative diagnosis is a guess based on clinical signs, without lab results. A confirmatory diagnosis uses lab tests or imaging to prove the disease. A clinical diagnosis is based on the animal's history and physical signs, like observing coughing and nasal discharge. A laboratory diagnosis depends entirely on test results. A postmortem diagnosis is done after death by examining organs for lesions. A therapeutic diagnosis is made when a treatment confirms the disease, like injecting calcium in a cow with milk fever and seeing rapid recovery. We also use differential diagnosis when symptoms match several diseases. For instance, Coughing and nasal discharge could mean pneumonia, tuberculosis, or bovine respiratory disease. The vet needs to compare symptoms and run tests to find the correct one. In all cases, it's vital to follow the NB rule, nota bene, meaning, take a full history, examine the animal thoroughly, and do proper lab tests, unless it's an emergency and treatment must begin immediately. Finally, let's look at treatment, or what we call RX in vet terms. The goal is always to get the animal back to normal as quickly as possible, and economically, especially on farms. Specific treatment targets the exact cause, like penicillin for strangles or adrenaline for anaphylaxis. Symptomatic treatment relieves signs, like antipyretics for fever, astringents for diarrhea, or expectorants for bronchitis. Supportive treatment helps the animal recover faster, especially during convalescence. Treatment of complications addresses new problems after recovery. Palliative treatment helps keep animals comfortable when they have long-term illnesses, but it doesn't cure them. Prophylactic treatment prevents disease before it starts, like vaccinations or parasite control. And that's a wrap. Now you know the key terms every vet uses, with examples to match. If this helped you, don't forget to like, subscribe, and drop your questions in the comments.